Hey, what's up? So you're interested in learning more about ADHD? You're in the right place. In this Hello Life moment, we're going to be talking to Dr. Jeffrey Chamberlain, a family medicine specialist. So you've seen a lot of kids these days in the practice that the parents suspect maybe they've got ADHD?
We see a lot of kids with ADHD or issues that they may have ADHD. It's one of the most common things that parents bring their kids in for.
Okay, define it. What does ADHD even stand for?
So we got ADHD, attention deficit hyperactivity disorder.
Mm-hmm.
They used to call it ADD, attention deficit disorder.
Right.
And you can break that up. You got the AD, attention deficit, and HD, hyperactivity disorder.
Mm-hmm.
Some people are just one. They have attention deficit. Some people have hyperactivity, and some people have a combination of the two.
Wow. So in the young, as they're sitting in front of people, what would lead somebody to suspect? Like, what would a teacher or a parent be looking for to say, I think there might be a problem here?
Okay. So all kids have some issues with attention,
Mm-hmm.
and so really we're comparing the kids to other peers, other kids the same age of them. And children with ADHD will have more problems with attention. They'll be shifting their focus from one thing to the other.
They'll stand out from the usual lack of attention that any young child might exhibit.
Exactly.
Right.
They might have a trouble. You tell them something and it's like they're looking at you, but they're not realizing what you're saying.
Mm-hmm.
They might have attention problems where they start doing something, but then they shift from one activity to another activity.
Mm-hmm.
Then also you have the hyperactivity symptoms where they don't stop moving. They're getting up, they're getting out of their seat, they're falling out of their seat, and causing general disruptions with their activity.
Well, it's interesting because they say that girls are less active than boys, or at least in a sedentary setting where they're learning that they have to teach boys differently, like have them move around a little more because innately they just are more active.
Yeah, that's true. A lot more boys get diagnosed with ADHD than girls do.
Mm-hmm.
A lot of times the girls that I see have a lot more of the inattention type symptoms, and so a lot of times they get missed because they're not disrupting other people, not causing problems in class, and so people aren't paying attention. They're looking at the boy who's disrupting everyone else, saying this boy needs help, but they're missing the girl who's having trouble paying attention.
Well, at what age would be the earliest onset of ADHD?
It's hard to say. Sometimes you can start to notice issues around 3 or 4, but usually we don't start really formally diagnosing it until they're more at school age, because a lot of development happens in those years, and so
Mm-hmm.
kids can change a lot in those first several years of life.
Alrighty, so we've defined it, talked about some of the symptoms, and now if you'd like more information, you're in the right place, certainly, hellolife.net, because we're all about matching your commitment to a healthy lifestyle. So dig deep into the videos, because we're going to be talking not endlessly but deeply about this disorder, which really seems to be more prevalent than I ever remember it as when I was a younger kid.
Yeah.
Yeah. Okay, so check back.